So everyone with diabetes is more likely than someone without diabetes to develop complications. And the complications affect the very, very tiny blood vessels throughout the body. And the complications are what we call retinopathy, which are the blood vessels in the back of your eye that bring blood supply to your eye. The complications are the small blood vessels inside your kidneys, which if they are damaged lead to kidney failure. And the small blood vessels that feed your nerves, and the nerves themselves in your hands and your feet, that can be damaged and you can get tingling or pain. That's called peripheral neuropathy. So peripheral neuropathy, renal disease and renal failure, the worst outcome, of course, is dialysis, or retinopathy, which if not treated can lead to blindness. And that's the same for type 1 diabetics and type 2 diabetics. And there are so many more type 2 diabetics that the number one cause of blindness in adults in the United States is type 2 diabetes. How do you avoid those complications? By controlling the blood sugar. If the hemoglobin A1C is below 7, you're much less likely to develop any of those complications. The higher the hemoglobin A1C, the greater the risk. And it's not just a straight line, it's a curve. So you get more and more risk every time you go up anywhere over 7. If your hemoglobin A1C is closer to 6.5, then you'll probably avoid those complications. What else do you need to do? Well, everybody with type 2 diabetes should be seeing an eye doctor, an ophthalmologist, someone who looks in the eyes and can look at the blood vessels in the back of the eye. And if they're damaged, there are treatments. And the most common treatment is a laser treatment to the eye, which is excellent and has changed the lives of people. You can take care of the diseased blood vessels and save your vision. There are more dramatic and extreme treatments that may be needed at some point in time, but getting ahead of the game, going to an ophthalmologist the minute you're diagnosed with diabetes and going regularly thereafter, not just for your glasses, but for the examination of the back of the eye. For the kidneys, every time you see your doctor, and I said you should be seeing the doctor 3 to 4 times a year, in addition to blood tests, there should be a urinalysis, a urine test, looking for protein in the urine, because protein in the urine is a sign of kidney disease. The other complications that you have to worry about are heart disease and stroke, and also the blood supply to your legs. Those are complications that are less associated, less connected to the blood sugar, and more connected to the other things that people with type 2 diabetes have, which is high blood pressure, high blood fat levels. And those are very treatable, and that's another reason you have to see your doctor. It's another reason you try to lose weight, because they're very, very responsive to weight loss, and they're very responsive to diets. And those are the risk for heart attack or stroke or loss of blood flow to the legs is associated with the blood sugar. I'm not saying it's not. It's not as closely related as the retinopathy, the nephropathy, and the nervous problems. So even if your blood sugars are well controlled, let's say your hemoglobin A1C is between 6.5 and 7, terrific control. You still need to know what your blood pressure is and have that controlled. You need to know what your blood cholesterol and blood fat level, triglyceride levels, are, so they can be controlled. So it's a larger number of problems for the person with type 2 diabetes, but they're all treatable. You just have to see your doctor and pay attention to what's going on with your numbers.